So today's topic is the calf strain. This is near and dear to me because I've definitely hurt my calf. So what we're going through is a calf strain. It'll be pretty straightforward. Talk about the risk factors and anatomy, symptoms of it and causes, and treatment for it. A typical pattern I see as a physical therapist is, hey, I began running, and recently when I was into my training program, I felt a pain in the calf, and it feels worse when I run, and I have a marathon coming up in a couple months. Should I run? What should I do? That's typically what we see, but sometimes we hear more acute stages. Like myself, I was playing I forget what the game is called, where you bounce a ball on a net. I heard a pop on my calf when I was backing up, and I actually literally thought it was a rock that hit me. I had no idea it was my muscle, and it didn't hurt too much at the initial point, but after a while it hurt pretty good, and I could barely walk. But yeah, I heard that classic pop, and it was swollen and it was very stiff. So that was my calf strain story. It happened more of a quick movement. So the calf strain is very common in the gastrocnemius muscle, so the double joint muscle. What that means is it crosses the knee joint and the ankle joint. And as such, it's a lot more demands placed upon that muscle. Just because it is a double joint muscle, it's more susceptible to injury, especially on the medial side of the calf or the inside of the calf. That medial head of the gastrocnemius tends to be more of a culprit for injury. Like any injury, if your weak spot isn't addressed, it will come up in some way, shape, or form, either through compensation or re-injury in the future. So if you have a stubborn injury, please address it. So the risk factors, here are a few. Sprinting sports are commonly seen, track workouts, doing repeats on a hill, because it's a lot more demand on the calf muscles to perform the movement. Overload of poor training. And I get to this one, I put an asterisk there because that's the most common thing I see in the clinic is I see a lot of runners, and a lot of them just are training too hard, too fast, too soon. Not necessarily sprinting, but just the amount of volume or intensity causing a lot more demand on that calf than they can handle. Other risk factors are just straight up weakness in the calf if they're not really just training it well, ankle mobility or lack of dorsiflexion or their toes coming up. And kind of go along with overload of the weekend warriors, usually old people like myself, the common age demographic for especially guys, because we go out and play like a basketball game and tend to hurt ourselves pretty easily. So watch out, weekend warriors. There are two big muscles in the calf. We got the gastrocnemius, again, which I says a double joint muscle, which crosses the knee and inserts across the heel into the foot. The soleus muscle, it's deeper to that, so underneath it. It's actually a pretty dang big muscle itself. It does not cross the knee joint, but it also supports the calf complex. In fact, the soleus muscle is getting more research about how important it is, especially for knee pain. So what does the calf do? I mean, there's a lot of functions it can help with, but one of the main things is stabilizing the knee from going too far forward. So if you're running and walking, the gastrocnemius and the soleus muscle get turned on during mid stance. What happens is the knee could really, based upon the forces acting on it, kind of buckle forward. And so the calf kind of helps stabilize it or prevent it from going too far forward too fast. So if you have a weak calf, you might see increased knee flexion or knee bending because it's just not controlled well. As a result, you could also have knee issues like runner's knee or patellofemoral issues or patellotendinitis. So it's good to really strengthen the calf, not for the calf and the ankle, but for the knee as well. It's interesting to note, there's a study by Dorn in 2012, seeing the demands placed on different muscles when you run. I just kind of pulled one stat to kind of put in your head. It's soleus muscle, not necessarily the gastroc, but the soleus underneath it. Running at a 740-mile pace is 6 times the body weight for the soleus muscle to dissipate, as opposed to the quadricep muscle, which is about 4 times the body weight. So the quad muscle is, of course, a bigger muscle, but it's amazing how much demand is placed upon the calf during running. So the main issue, like I said, is usually overload. Again, going too hard, too fast, too soon, especially novice and new runners who don't have a proper training program of how really to ramp yourself up. If the demands exceed the tissue's capability to withstand forces, then an injury or strain result. I don't want to confuse this with delayed onset muscle soreness or DOMS, which is common in working out. You actually do disrupt the fibers when you do load tissue, say like a bicep curl or squats. You might get some quad soreness, and that's very common for working out. But it's a very low-grade strain, which the body will recover and get stronger from. So I just want to make note that DOMS is common, not necessarily a pathological thing or injury. It's just common after working out. It's really when you can't move well or like limping around and it really disrupts your function. That could be considered more of a strain. A lot of people with calf issues, especially after injury, tend to want to stretch it. And it's not necessarily too bad, but really in the beginning, in the acute phases, you are healing a strained tissue, meaning there's some micro tears in the fibers, and the calf just needs to heal, and at least the initial part to get the pain down. So stretching your calf probably won't help too much, especially you won't get the strength back. So when someone comes into the clinic and they have a calf strain, I actually say, hey, you can foam roll it, some self-massage, but I would avoid overly stretching it. And depending on how bad the pain is, I would either just chill till the pain gets down a bit. If it's pretty manageable, then I start loading the calf first. So calf stretching comes a little bit later, not initial after injury. So be aware of, you don't need to stretch it right away. Usually acute versus chronic. The acute is a quick strain, high sharp pain. I heard my pop. The chronic, mostly with long distance runners, it's more gradual onset and kind of feel uncomfortable. It's pretty straightforward. When they point to the calf, it's usually a calf strain. Now, there could be other issues associated with that, like sciatic nerve issues, potentially, a smaller muscle like the popliteus, but those are less common. So when you point to the calf and they feel maybe a nodule or a tender spot, it's probably a strained calf. Again, some might get redness and swelling. And if you want to test it, go up on your toes. If it hurts, it's probably a calf strain. If you can't really tell, go on a single leg, and that will tell you. So the first phase, like I said, is let the pain go down. You can do that with, I don't really care if it's ice or heat. There's debate among that. But you can tape it. You can just bike to just kind of get the fluid moving. But in the initial phase, you want to unload it for a week or two, depending on how bad the strain is. But what a lot of people do is, and I understand, is afraid of the pain. They don't want to keep loading tissue that might be uncomfortable. But if they keep unloading it for, weeks or months, the tissue isn't getting stronger. In fact, there could be some scar tissue development, and it has to be, worked through. So after the pain phase has gone down, I start to load the tissue, especially on a step. So I start with double leg heel raises, actually without a step first, see how it feels. If it feels good, go on a step. And if they can do the heel raises with pain less than 3 out of 10, you're okay. My criteria, and we did a presentation about this, but I say, hey, if the pain is less than 3 out of 10, if it doesn't linger the next day or that night, you're good to go. So I usually start conservative, start with double leg heel raises and progress along. Again, if it feels easier, the pain's going down, I add weight or load. Usually 3 to 4 times a week. Some people maybe do more, some do less. But I generally say, hey, beat it up one day and let it recover the next day and just see how you respond to that. Soft tissue is fine. You might feel some nodules like scar tissue formation in the area. So self-massage with like a foam roller or your hand to kind of work through that tissue is fine with me. In the beginning, like I said, I don't really stretch the calf too much, but I do, after a few weeks to kind of work into that as well. Again, it isn't my go-to. And I see a lot of patients like, hey, keep stretching, but the pain's still there. Well, you're stretching a weakened tissue. You have to build up the strength for that. This is 2017 study of 566 people. The study just want to see the reliability, one, of doing single leg heel raises. How reliable is it? Measure of calf strength. And also, what are some normative values of people? After they tested a bunch of people, these are some normative values based upon age group and gender with where you maybe want to be. With time, it's interesting. Usually about the age of 60, they found that females were able to do more. I tend for my patients, want at least at 25. And I just want to throw this out there. We have a calf pathway that takes you from 1 to 4 phases of gradual progression of loading the calf. I don't use these too often, maybe the tape more, but sometimes people need a little bit of recovery rest from the calf strain. So one simply is getting a heel lift. You can get over Amazon or probably even CVS type stores. You can put that in your shoe and that unloads the calf a bit. Taping also helps unload the calf. And I prefer ice. You can do heat too, depending on the stage of healing. My bias towards the beginning, especially the acute phase, ice tends to vasoconstrict a bit and reduce the amount of inflammation. If it's after a week or two, heat or ice, I don't care too much, whatever feels better for you. But like I said, I don't use this too often for the heel lift, but tape I use more often, but people respond well to both if they need it.